afternoon. My name is Jae-Jae Spoon, and I'm Professor of Political Science and Director of the European Studies Center at Pitt. Welcome to this month's conversation on Europe, which is part of our Year of Recovering Europe series. Today's topic is an uneven pandemic recovery, disparities in health, economic, and education outcomes across Europe. You will have the opportunity to ask questions using the Q&A function. Feel free to post a question at any time during the discussion, and I will try to get to as many of these as I can. Feel free to post comments in the chat as well. Today's conversation is sponsored by the European Studies Center, which is part of the University Center for International Studies at Pitt. It is co-funded by the Erasmus program of the European Union. Our co-sponsors are the following: the Pitt Center for Bioethics and Health Law, the Georgia Tech Center for European and Transatlantic Studies, the Miami, Florida Jarman Center of Excellence, the European Union Center at the University of Illinois Urbana-Champaign, the Jean Monnet Center of Excellence at the University of Florida, and the Center for European Studies at the University of Texas at Austin. To learn more about our upcoming conversations on Europe, as well as other programming and our Year of Recovering Europe, please visit our website, and that will be put up in the chat. Here you can also find recordings of past conversations and additional materials. Finally, I want to thank my colleagues Iris Matijevich and Kenny Riley for their help with today's event. The effects of COVID-19 have been felt unevenly across Europe, a trend which continues into the recovery from the pandemic. We are seeing these disparities across groups of individuals, across regions, and across countries. Today, I'm joined by three experts who will discuss the differences in how these inequalities have been experienced both at the individual level and at the national level in terms of health and educational outcomes and economic impacts. I'd like to welcome first Holly Jarman, who is Associate Professor in the Department of Health Management and Policy at the University of Michigan School of Public Health. A political scientist, her research focuses on the impact of trade agreements and economic regulations on domestic health and social policies, and more recently on comparative health policy around COVID, with a focus on the US and the European Union. Her work has been published in journals which include The Lancet, Government and Opposition, the European Journal of Public Health, the Journal of Public Health Policy, BMJ Tobacco Control, and Public Policy and Administration. Her monograph, The Politics of Trade and Tobacco Control, published by Paul Greg Macmillan, explores the consequences of trade law for tobacco control policies. Next, I'm pleased to welcome Martin Myant, who is Emeritus Professor at the University of the West of Scotland in the UK, Scotland, UK, and Associate Researcher at the European Trade Union Institute in Brussels, where he was formerly head of the research unit on European economic, employment, and social policy. He has published widely on economic and political development in East Central Europe. His publications include Transition Economies, Political Economy in Russia, Eastern Europe, and Central Asia. And recent contributions relevant to COVID-19 include the economic and social consequences of COVID-19 in the edited volume, Social Policy in the European Union, State of Play 2020. Last but certainly not least, I'm pleased to welcome Sylke Schnepf, who is a senior researcher in the Unit Monitoring Indicators and Impact Evaluation of the European Commission's Joint Research Center in Ispra, Italy, and a research fellow at the Institute for the Study of Labor, ISA, in Bonn, Germany. Previously, she was an associate professor in social statistics in the Faculty of Social and Human Sciences at the University of Southampton in the UK. Her research focuses on patterns of cross-national educational inequalities and counterfactual impact evaluation of policies aimed to mitigate these inequalities. She is also conducting research in the fields of survey design, fairness, and loneliness. Her research has appeared in Higher Education, the European Economic Review, the Journal of European Social Policy, and the International Journal of Comparative Education and Development, among others. Unfortunately, our fourth panelist is unable to join us today, but she sends her regrets. Welcome, everyone. I thought I would start us off by doing a tour of the participants and asking what would you say is the biggest disparity we're seeing across Europe in terms of the impact of COVID? And as you respond, you may think also about how different groups are being impacted and some of the differences across countries. So Martin, would you like to start us off with this question?
Start, yes. Of course, it's not over yet, so we don't know what more is going to happen, what more disparities and differences will show up. But the important introductory point is that it isn't just COVID that had an effect, it's the measures that were taken against it. So in practically all European Union member states, there was fairly early on a very strong lockdown of economic activities. That then required supporting measures to mean that jobs could still exist, that businesses could still exist afterwards and so on. But the assumption or the hope was that this would be relatively short. We could then come back and everything would be okay. We could carry on, hopefully, as if nothing had happened. I found that a very surprising expectation at this time. It seemed to me not to have understood the nature of this particular disease at all. And what has actually happened since then is we've had a whole series of reintroducing restrictions, taking restrictions off. In practically every country, it seems to me, they've made more or less the same mistake. People in power hope it's over, believe it's over. If they have expert advice to the contrary, well, let's hope it's wrong. They're not absolutely certain. Let's hope it's going to be all right and we can relax. And there are various business interests pushing them in that direction all the time. So we've had an on and off of restriction and relaxation. And in a number of countries, we're going back into restrictions now. Now, what makes the differences, or one of the many things that makes differences between the countries, is how able they are to afford to support people who are not working, who are in various forms of partial employment, partial unemployment, however they want to call it. And basically, the richer the country is, the better support it has been able to give. They're able to give a certain amount everywhere, a certain number of things the European Union as a whole has helped with, but that marks out one difference. So people have been more likely to lose their jobs and suffer hardship in countries that are not so rich. It also depends on the kind of job that you do. Is it one that you can do from home? And basically, the richer we are, the more high-skilled jobs we're doing, the more likely it is that we can do it at home and will continue to be paid there. If we're casually employed, we may well find that our job has ended and we face substantial hardship. And incidentally, also, we're likely to have less savings to see us through a difficult time if that is the case. And we're likely to be living in a country where unemployment benefits are less substantial. So that's enough, I think, for me to start, that there's those sort of things mark out differences.
Thank you very much. We'll circle back to some of the things that you mentioned in a minute. Holly, would you like to?
Sure. So I think I'll start by saying I agree with Martin. So I think one of the biggest distinctions is, not only the kind of work you do, but also where you live. So some people's COVID exposure and risk was going to be much higher than others. So for working people, especially people who can't work from home or who work even in a crowded environment, who also might already be more marginalized populations in some of these countries. For example, migrant laborers, I would say, are at quite a big bit of risk, because not only are they in a working environment where maybe their job is tenuous, or maybe at this point they couldn't actually sustain work, but also they're living potentially in a more crowded situation. They may be more reliant on public transportation. And so the various factors of their life come together to increase risk for some people over others. I would also say, in terms of the severe outcomes of having had COVID, there are a couple of groups that we could point to as having had a worse pandemic than others, particularly if you look at the health effects on older populations versus people who are a bit younger. Now, maybe some of those health effects, as Martin rightly pointed out, the pandemic is still ongoing, and I think it's too soon to talk necessarily about recovery or the end of the pandemic, if there is such a thing that we could mark. But overall, for now at least, there's been a more substantial impact on people who are older, people also who've had chronic conditions. And so that too is linked to various social inequalities in terms of to what extent those people have had access to healthcare, good preventative care over their lives, the situations that they found themselves living in, and how that relates to developing a chronic condition or not, which then in turn impacts the outcomes from contracting SARS-CoV-2. So I would say that's one of the most significant things I've been looking at as more of a public health person. But then my political science brain is looking at the political and social determinants of this. So I would say who is not just the impact here, but also the overall trajectory. Have we seen an acceleration or a deepening of inequalities? And in some of the countries that I study, and I would point to the UK as an example of this, we're seeing greater inequalities for not just COVID reasons, but maybe some other reasons as well to do with their economic trajectory over time.
Great, thank you so much. Lots to circle back to in the conversation. Sylke.
So just before I start, just to give you a disclaimer that I'm not talking for the European Commission here. So what I will say is not necessarily the official position of the European Commission. So as you kindly introduced me, I'm in some way an education person, I'm an education expert. And hence when I hear about groups and COVID impacting on groups, I think about children. So we had children, we know they were less of risk being infected, but they were highly impacted on by not attending school, right? So we had in Europe about 58 million kids on first, second prior, so primary, secondary, not attending school. And this certainly, since schools are about many things besides learning, they provide health, they provide caloric regular intake, they provide support, they provide friends. So that was a major impact on our children in Europe. So there are studies, so it's an OECD study which says if you only focus, I mean, there are lots of things to focus on. I mean, Holly probably has done some research on mental health. I don't know, but there's mental health issue, there's and education outcomes. There are many things to think about it. But if you focus just on educational outcomes, there's this OECD study saying that if we do not counteract possible learning loss due to school closures, students would lose something like in their adult life 3% of their income over their entire lifetime. So there are some kind of calculations showing that there is possibly overall quite a big learning loss. So, however, if you talk about the impact, so sorry, I'm coming from economics. So if I think about impact, I think about causality. And then I think about data, because it's not quite easy to show causality. And I think the education factor very different to when we talk about the health data that Holly might have access to, or labor market data, that is very timely. Education data on outcomes is not timely at all. And hence, I feel that in my subject area, it's very difficult to say a lot about impact, because the data are currently still very restricted to single country studies and different kind of data sources where you are not quite sure whether you can really talk about causality here. In terms of the different groups, so research indicates that it is students with lower socioeconomic background that are hit, those students with lower home resources at home, right, who could not participate properly during physical school closure, as well as migrants. And at the European side, so if you think about countries, you asked about countries, so country differences. So our research at the Joint Research Center shows that we need to expect that overall differences in average learning outcomes between countries will have increased during the pandemic, as well as within country inequalities in educational outcomes. And I think this is quite a problem, because as educational inequalities are a big driver of economic inequalities, that is quite something we should be concerned about, also in terms of social cohesion, which derives from big economic inequalities, and social cohesion is for Europe, I think, quite a big topic. Thank you.
Wonderful, thank you. I think you've given us about 2 hours of things to talk about with everything that you have all introduced. So thank you. So let's sort of circle back to some of the things that that you've all mentioned in terms of disparities. Right, we've covered everything in your opening comments, from unemployment to where you live, different types of groups in society, public health, and et cetera, and how those are all playing a big part in affecting kind of the impact and the ongoing impact. And of course, the pandemic is still ongoing for the foreseeable future. So perhaps we could go back to what Martin started us out with in terms of thinking about the labor market and employment more generally, and thinking about sort of some of the effects that we've seen. We obviously are continuing to see on the labor market, and thinking about sort of different sectors within various labor markets that are being more or less affected by the pandemic.
Sorry, is that for me to say?
Yep, you're fine.
Right. Just to come back to one other point that was made before, that Holly emphasised it's the older people who've suffered. Sylke emphasised it's younger people who've suffered. And I think if you take it in health terms, Holly is clearly right. If you take it in economic terms, the big people who've been losing their jobs have been younger ones, and the people who've lost their education have been people at school and so on. So it's been sort of uneven in how it's affected. Sorry, I've lost track of what the topic was that you'd introduced.
No problem. I just wanted to perhaps dive in a little bit more in thinking about the labor market sector.
Yeah. Right. So when initially the lockdown measures are introduced, they affected quite large parts of the economy. So there was manufacturing industry, parts of that closed down as well, but opened up very quickly. They found people could work there okay, and it wasn't a problem. But the sort of restaurants, hotels, and tourism related things, those were hit very hard. And some of them can't function properly, even to this day. Now that has an impact in Europe, because there's a tendency in Europe for the people in the north of Europe to go to the south for their holidays, whereas people in the south buy things made in the north. And that, if you like, is the sort of trade arrangement within the European Union. And so that means a big problem for southern European countries if they're heavily dependent on tourism industry. And so those are affected quite severely. Also, the kinds of people who work there, likely to be young, likely to be temporary employment, so they're likely to have suffered quite a lot. They're the least likely to be covered by the various support mechanisms. So that's one difference that comes through in terms of the sectors affected and the countries affected, and the labour market being differential effect hitting them. Now, the other side to it, there's some of us able to work from home or able to enjoy an income by some means or another, and we haven't been able to spend it. So on the one hand, we've got some people who've lost out, and others who actually have stored up quite a lot of money that they can spend. Indeed, you do spend it, but you find that the price is enormously much higher if you want to do anything tourism related. So those anyway are some of the differential impacts on employment and economies.
Great, thank you. Holly, I want to come back to, you mentioned in your opening comment, thinking about migrant labor as well, and how migrant laborers may be and have been disproportionately affected. I wonder if you could speak to that a bit more as well.
Yeah, and so this fits in very neatly with Martin's focus on some sectors where, so hospitality, for example, migrant labor is quite predominant in that sector. And so some of the sectors that have been most affected by lockdown, including hospitality, restaurants, retail, some of these lower paid jobs where people might be in a temporary position also tend to be, that's where you might find migrant laborers. And so also to the question of not just migrant laborers away from maybe their home country and they've been there for a while, and then them being affected by lockdown and not necessarily having access to the social policies that might mitigate some of those problems, but also people who would normally migrate to find work in countries where remittances are actually quite important for the bottom line in those countries, might not necessarily have been able to go and find that work. And so that's led to a dire situation for some people who would normally rely on some people in the family going abroad, sending money back. That pattern has also been disrupted by the pandemic. And I would say too, the one other thing I wanted to add to Martin's comments was the effect of the pandemic on working conditions in some sectors, including obviously healthcare and social care. This has put a lot of strain on people in those sectors. In some countries, a lot of those workers have, if they have been closer to retirement age, have chosen to retire. Some of them have chosen to quit. And there's a shortage in a lot of places of those kinds of much needed workers. But also the strain on, for example, people who work in logistics, who drive trucks, who distribute things, in terms of like the people staying at home as the economy has picked up. There's been a surge in reliance on deliveries, ordering products from online rather than going to the high street store. So some of those changes have also put a strain on the logistics sector. There's a lot else going on there.
Sure.
Sure. But I think you're also dealing there with, especially in things like trucking and aging workforce, where some of those people have reassessed, as the healthcare workers did, their risks and their working environment, and maybe said, well, I'm going to retire, I'm going to change what I'm doing. And so those are also much needed skilled jobs where it's difficult to replace those people on short notice, and that's caused disruptions across Europe.
And I think something else that not directly related to the labor market, but with, as both of you were just discussing, right, the choice where people have the choice to remain working remotely has and will probably continue to have even bigger effects on what center cities look like, right? That were largely populated by office workers coming in and not only occupying the buildings during the day, shopping at the high streets, shopping at various stores, restaurants, things like that. And with people staying home and shifting things more to sort of continue to shift them to a virtual environment, that sort of knockoff effect of what's happening in the labor market happening on sort of the urban environment, real estate, all of these kinds of things, which are, of course, other sectors. So it's obviously a sort of domino effect that we're seeing, of course, and we'll continue to see, right, is I think the theme of this discussion, of course, is that things aren't over and we're continuing to see and things develop as we move forward. Sylke, I want to come back to you and give you an opportunity to talk a little bit more about some of the effects of obviously children being at home for a year in some cases, unequal access. We've definitely seen that in the US. Maybe to talk about if that is the same, but unequal access to things like broadband and workspaces at home and things like that, and how that's having additional effects. And if you found any of that in the research that you've conducted, that has, sort of additional effects, not only on learning, directly affecting learning outcomes, well, directly or indirectly affecting learning outcomes, I would say.
Okay, yes, thanks. But before I come back to this, I'd like to come back a little bit to Holly and Martin. So certainly in terms of sectors, me as an education person, right, I think about teachers. There's quite very, very nice study for England on the mental health, stress status of teachers, which shows that, and so my headmasters had something like a 3 times higher stress level the week the school closure was announced, right? And then something then it leveled off while online learning was on, and then the week before the school opening was announced, the stress level increased again. So I think this is also a sector that was very much the teaching sector is also, and that is quite of importance in this whole thing, I think, because there was quite a lot of pressure on the teachers as well to adapt to these kinds of situations. Another group that comes to my mind is women. also because a lot of my colleagues at the Joint Research Center work on the disadvantage the pandemic had on women workers. And I think this is actually also quite an interesting discussion topic. But coming back to your question, so yes, so there is research showing that there is association of certainly lack of learning progress during the pandemic due to the lack of home resources. Okay, but the research we are doing in some way, I said that there's a problem with data, right? And there's actually no comparable COVID data available for European countries. So so the data kind of sources we are using is a survey data, which is called the Transit International Math and Science Study. There are several kind of cross-national survey data out there. You might have heard of PISA, I'm not sure, Program in International Student Assessment, which is organized both by the OECD, and then there is a third International Math and Science Study, so this is IEA, and PEARLS data. So there are different kinds of, so there is this kind of pre-COVID data, which is the only data at the moment available to say something about COVID, which I know it sounds very strange, but this is the kind of data like we have if you want to say something about Europe and compare European countries. And these data are very, very rich in showing how inequalities in home learning resources were distributed across European countries. And there we find huge differences, for example, in Bulgaria and Germany as well. Less than 10% of kids had access to internet. I mean, that which is in some ways basics right for participating in online learning, and very different to Northern European countries where it was 1 to 2%, right? And there are many other learning resources we look at. And if you compare the countries, so our results show that that those countries where kids lack more learning resources are clearly also the poorer countries. We had this problem before when Martin was talking on this topic. So the poorer countries are certainly also the countries where kids lack more learning resources at home. And these are the same countries that also on average have already in European comparison quite low relatively low achievement, you know. So this leads to the fact that in those countries with already lower achievement, we have also kids who will be less able to participate in online learning. And this clearly will lead to the fact that those countries which are already relatively worse off will get even more worse off. And this will lead to European disparities overall. And this is quite important because, I mean, as you know, in the European Union, the education policies are certainly the responsibility of the country. So there's a subsidiarity process principle going on. But on the other hand, European countries want to work together in concerted actions. And hence we will need to accommodate, also in the future, it will need to be, the help needs to be more targeted to probably quite different looking education outcomes across European countries.
Great, thank you. I actually want to circle back to something you started with, responding to a previous question about sort of the education sector and teachers more generally. And I just wonder, and this is maybe more speculation on your part at this point, but I think that thinking about, you know, teachers as, you know, being very affected by COVID in the sense of, you know, having to adapt, having to teach both hybrid, you know, online, virtual, having to teach, you know, with masks. I mean, I think of my daughter's school, everyone is still wearing masks. They have plexiglass in between every single student. They're outside all the time. They're eating outside. Last winter, outside in the middle of winter in Pittsburgh, it's not very nice, but they were eating outside. But just all of the stress of, you know, for teachers in trying to adapt and to make, you know, the environment safe and also a good learning environment for the students who are there in person. And I just wonder if you or if anyone else, again, perhaps more speculation at this point, but if we, you know, if that we see that perhaps having a long-term effect on not only on teachers, as we've seen perhaps in the healthcare sector, teachers leaving the sector, choosing to, you know, pursue other pursuits, if that's going to have any sort of long-term effect on, you know, their sort of the mental health of teachers. Students going into teaching, just, you know, kind of long-term effects that we might know from, you know, other past, you know, past experiences that may have some effects in the future.
Okay, so teachers are not directly my research subject. I nevertheless wanted to find out more about teachers' mental health, because in some way students' mental health and students' outcomes certainly depend on teachers as a building stock for their development. So that's something that I read into a bit, but without much success. I mean, I sound a little bit boring, but really there's not much we know about. We do not know much about children's mental health, and we do even know less about teachers' mental health. So what we have in some way are single studies where on specific kind of kids, perhaps in specific kind of areas where we are not quite sure about external validity. So how far we can abstract from these tiny results to the overall population. And hence I just studied this English study because that was actually the only one where I really saw someone using more, perhaps, probably, hopefully, population representative data, so that we can abstract that to the population of teachers overall, but otherwise it's very difficult to say something on that. I think that there is some kind of data supporting that teachers, or I think there is some teachers on data on teachers' happiness showing that teachers thought more about leaving their profession. But given that it's not really my research area, I wouldn't like to discuss this in greater detail.
Sure, no, that's fine. Martin, and then Holly.
I don't know whether teachers are exceptional, but there does seem to be a phenomenon that quite a lot of people are not coming back to work. I think it's been talked about and observed in the United States more than in Europe, but the rate of unemployment is probably marginally lower now than it was before the pandemic, and hasn't really changed very much. Now, of course, to count as unemployed, you have to be looking for a job. There'll be very good reason for not bothering to look if you're not going to find one. So that doesn't prove very much. But if you look at the number of people in employment, that has significantly fallen. And there are jobs there are shortages there. So people, for some reason, one reason or another, are deciding, I'm not coming back to work. I'm not going to. And as I say, that seems to be quite common across quite a lot of occupations.
Thank you, Holly.
Yeah, and if I can follow on for that and compare to the American situation, I think in America, the comparatively huge increase in terms of social spending and support mechanisms, limited in time and contained in sort of these mega bills, but especially the first stimulus package had this enormous change in the way that the American welfare state worked, compared to some social policy packages in European countries, which were improving upon a little bit upon an existing baseline. So I think that increase was much greater in America, but all of these things are time limited. So I'm waiting to see, I think we're all waiting to see what the impact of those time limitations kicking in on some of that social spending might be, definitely in America and almost certainly in the context of some European countries as well. I wanted to also follow on from Sylke's kind of discussion of like gaps in the data. I think so. One big gap really is in terms of trying to understand inequalities in Europe. So for various important historic reasons, some countries don't collect the same kind of racial and ethnic data that you might find commonly in the UK or the US. And so there are good reasons for that. But I see more scholars questioning that during the course of the pandemic, because to some extent, we don't know the scope of the problem. We know from people's lived experiences that different racial and ethnic groups their pandemic is very different. The experience has been very different in terms of risk exposure, severe outcomes, economic consequences, but we can't characterize that at the population level in a lot of cases because we don't have the data. And so those questions have been kind of raised again in the context of some European states.
No, thank you. And I think that, yeah, that's important. Obviously, we're seeing there are obviously differences, but of course parallels between the US and many European countries, and thinking about sort of, populations disproportionately affected. And we're seeing both by COVID itself, but also by economic inequalities, educational inequalities, that sort of thing as well. Holly, I want to come back to you and turn to have you put your your public health hat on a little bit here for a minute. Okay, now we have that. And to ask you to sort of reflect a little bit on sort of how, now that we're thinking we're recovering somewhat from COVID, or at least we have now 20 months of experience with the pandemic to think about, and how sort of public healthcare systems and the varying landscape of public healthcare systems across Europe have affected the effect of COVID, the recovery of COVID. Obviously, it's a huge question. So however you'd like to address that.
Sure. So there's a lot of variation, so I'm going to skip over a lot of things. And also my caveat is that I focus much more on Western Europe, so I know the systems better. But I would say in a lot of cases, actually the model is quite often sort of a CDC style model, so a little bit similar to the CDC, sometimes directly influenced by the CDC, where you have public health agencies at the top and preparedness planning and some of those features in different countries. In some countries, what we found within my research team is it's not necessarily connected to a really good public health delivery system underneath. So France is a good example of this. They have a well-rated set of public health institutions at the top tier, but it's not really connected in the same way to enough of a workforce that can deliver public health data, act on public health policies. And so the model that we've kind of got is sort of thin, a little bit too focused on emergency planning and that kind of and the response at the high level in terms of gathering data and things. In some countries, those public health institutions that exist have also been sidelined. So you've had different expertise brought in. France, again, is a good example. Different expertise brought in. So central experts have been advising on the pandemic, and the whole public health apparatus has been somewhat bypassed. That's not the case in Germany, for example, where I think there's a much better connection and a connection that's much more bounded in law between the public health institutions and experts who are supposed to be advising and the central government that's making decisions. So in Germany, on the contrary, the problem has been largely a set of problems around federalism, coordination among the Länder, and then the relationships between the federal government and the states. And so in the initial period of the pandemic, you had public health agencies acting independently in each state, as they are constitutionally supposed to do. And then over time, more pressure for the federal government to take more unifying actions. And ultimately, the last law that was passed on the pandemic was actually quite federalizing it or centralizing in that sense. And so the public health agencies are in some cases weak, in some cases underfunded, in some cases sidelined, sometimes focused on the wrong things, and have difficulties in some countries coordinating amongst themselves where that country, where federal authority is not the only authority in the picture.
No, yeah, thank you. And I appreciate, sort of thinking about sort of state structure and the role that federalism plays. And so I just wonder then, thinking kind of up, thinking towards the EU, that if, where we are in some places seeing coordination across, states at the state level, let's say, as you mentioned, in Germany, between the centralized government and the states of the Länder, are we seeing, or have we seen, or can you think of, examples of coordination and responsiveness across EU member states, where there is some coordination, or just whether it's a coordination or just sort of responding to best practices that we're seeing, across member states?
Yeah, so there's definitely examples of coordination. I would say on the case of coordination around vaccines is an interesting one, because on the one hand, there were examples of some states kind of acting in an economic nationalist way, especially quite early on. The collective response from the EU is arguably was more consultative, I would say, than I might have expected, and brought countries together, but it did so in a slower way. So where there were countries that kind of got impatient about vaccine access, I think there was some tension and struggle in that process. So that's quite distinct from countries outside of the EU, where it was a free-for-all really around PPE, personal protective equipment, and also trying to get vaccinations. So one of the big contrasts now, I think, is between EU and non-EU countries. If you look at some of the countries that have not necessarily had good access to vaccines from the start. So I would say Ukraine is an example of this. Ukraine didn't initially have good access to, it couldn't get their own vaccines commissioned, so they didn't have a contract independently. They had signed up for COVAX, but COVAX vaccines were delayed, and they eventually got some help from other European countries. But as a result, vaccination in Ukraine lags behind some other places. So it's just one example, but for each country, things like access to vaccines depend upon who are they collaborating with, how powerful is their own economy, can they purchase or procure things like PPE or vaccines independently, or do they have to rely on a mechanism that's collective that might take a bit longer? And so that has been a source of difference across different countries in the wider European region.
Great, thank you, Martin.
Yeah, just to add something on some of those points, that the public health services in different countries, yes, they vary in quality, and yes, some more adequate than others. But when this pandemic started, it doesn't matter how good your health facilities were, you couldn't cope by a health service alone. You had to understand that the only way to stop this spreading is to close down a whole lot of social activities. That was difficult in a number of countries, and it was difficult for them not to forget the lesson shortly afterwards. Now, the vaccines issue, there are there's variations across the European Union in what proportion has been vaccinated, and it goes right up to 90% of the population is just about the highest figure, and right down to not much over 20%. And you would think, well, does this mean they don't have the facilities to do it? And the fundamental difference seems to be in attitudes in the population, that in Bulgaria, as confirmed before the vaccines arrived and were rolled out, there were a large number of people saying, no, we're not going to take it. We don't think it's necessary. Partly they haven't seen how dangerous the pandemic is, but partly whatever reason of distrust towards authorities and what they're being told. That comes from the bottom, but it also, of course, goes all the way up, that top politicians also are not pressing it. They're not saying the vaccines are the important thing. The past government has failed because of that. They fight an election campaign over completely different issues, hardly mentioning that whatsoever. And I would have liked to think that governments took advice to a great extent from well-informed experts, that they had established a committee of experts which could debate openly, that could take in views from outside, that could be well aware of research that was going on. And to a certain extent, all governments have ignored their experts. But if you don't really have a Nobel Prize winner who is going to come and say, this COVID skepticism is nonsense, it becomes much harder to counter the sort of stuff that people are getting from social media. And that seems to be demonstrated as well, that vaccine skepticism goes very much with my main source of information is social media and not any kind of official media. But even the official media, as I say, in some of these countries are not playing a clear-cut role. They're playing a role, well, there's one view that, and there's another view that. We must take seriously the view that vaccines don't work, they're not necessary, they're probably unproven, possibly bad effects, and so on.
Thank you. Sylke.
Yeah, just to add a tiny point on that. So I absolutely agree with this discussion. There's some research on trust in governments, right? And there are huge European differences in that. And it's certainly it's Eastern European countries where generally trust is quite low, which is perhaps not so surprising, right? Given the past. Of these countries and hence in some way also this kind of trust, and suddenly there's something coming from above what we should do, which also might in some way not increase very much the willingness of taking these vaccines up.
No, and thank you for mentioning this. It was something I was going to emphasize, which I think is this throughout the pandemic. I think we have seen that levels of trust, levels of satisfaction with government have really, of course, they vary across Europe, and that we've seen from everything as well we've been discussing, sort of vaccine take-up rates, but also protests against the vaccine, following all sorts of measures to keep people safe, mask mandates, things like that, where we've seen more, following of what government is requesting of people, that there is, that does highly correlate with levels of dissatisfaction, trust, and things like that across Europe more generally. Martin, I want to come back to you and talk a little bit about sort of, like as opposed to Holly, how existing public healthcare systems has affected some of the outcomes that we're seeing. And I wonder if you could talk about sort of existing social policies that we've seen, and some of the things that you've perhaps looked at and how that may have affected some of the outcomes that we're seeing across the continent.
Existing social policy. I think we have touched on this, that the level of provision does vary between countries. So, for example, if you're in Poland and you're unemployed, that is really a very small part of the qualification required to get unemployment benefit. You need to jump through a whole number of further hoops before you'll get any state support for it. So that the level of support varies considerably across countries. The point was made that in the United States, you didn't have so much anyway, so that in Europe, to a great extent, it's adding to what's already there. But they've added a lot as well. The support for people to be partial unemployment or partial employment, however you call it, that they'll be paid even while not working, is for most countries a new thing. It existed in various forms in some, but for most, it's a new thing. I think in almost all countries, there's been an addition to the state benefits given to the lowest incomes anyway, meant to be temporary and meant to be withdrawn as the pandemic hopefully ends. So that reduces the sort of pain for some parts of the population, but to different extents depending on what country you're in. I don't know if that's enough to start the discussion.
Sure. Holly, do you want to follow up on that with some thoughts?
Yeah, so I think I agree. And for me, I think I might have to wait for like a full assessment of this until afterwards. But I think the difficult part when doing social policy comparisons across countries is how comparable these policies actually are in different places. I think the labour market reforms, as Martin alluded to, are a little bit more, a little bit deeper and a little bit more substantial than some of the social policy spending. But there's also been additional healthcare spending, and the big question, as I said before, for me, is how time limited each of these things are, and whether or not we'll be seeing then a corresponding shift in people's behaviour. I also wanted to say something more about vaccine hesitancy. Sorry for jumping around. It's just, I don't want to interrupt anybody. But we have quite good data in public health about people's prior vaccine hesitancy before the pandemic. There's actually really quite good international studies, as good as you can get, asking people about their opinions of like the safety, the efficacy, and the importance of vaccines. And so, yeah, we saw that hesitancy definitely in certain countries in Eastern Europe. Certainly also in countries like France, there was uncertainty, it was very high around the safety and efficacy of vaccines. And these are non-COVID vaccines. But I think everything we see indicates there's a little bit of a, either things have been getting rapidly worse in terms of trusting government, which correlates very well with people's vaccine hesitancy. But there's something a bit different about the COVID vaccine versus prior vaccines, and people are making, at least in their own minds, making that distinction. And so I think the hesitancy problem has got a bit worse. What remains to be seen in the data is whether we're going to see hesitancy around the COVID vaccine and lack of trust in the government in that context translated into other areas. So for a start, other vaccines going forward. Are we still going to see good uptake of other routine vaccinations going forward, or will hesitancy over COVID translate into hesitancy for those other vaccines? And to what extent will we see a backlash against public health measures in general that are during non-COVID times? Public health tends to suffer from this tendency as a sector to get loads of attention in a crisis and then have its less attention when it's stuff that people find less salient, like routine preventative care and surveillance. And so I wouldn't be surprised if when the imminent, if we can get to this point, the imminent danger of COVID has passed, there'll be some budgets cut or some refocusing of public health. But I think it'll probably be very different in different places. Sorry, Martin.
Martin, go ahead.
Can I just ask Holly to clarify or confirm something? That I think I've seen that in the cases of Eastern European countries, there's a very high take-up of previous vaccines, and this is something that marks a real change. The obvious thing that has changed it is the extent of the social media campaign against this one, and it's a depressing thought if people are convinced by that so easily and totally. But I'm asking, do you think that's the case?
I think it might be. There's not a lot of good evidence on that specific point, but more is coming out. So, for example, there were some good studies done of Balkan states and their hesitancy and the links between people's beliefs around conspiracy theories that they found online and then their vaccine hesitancy. And there are quite strong links there. So it's definitely connected actually in an international way via social media. People who believe that there's, that hold some beliefs around how global politics works or what the forces are shaping us in terms of politics. If you hold those beliefs, you are more likely to be hesitant around the COVID vaccine. And so it's a little difficult to tell. I think that's a really substantial factor. There is also the complicating factor is what kind of vaccine too. People trust Sputnik less, for example, than some of the like Pfizer or AstraZeneca vaccines. And that is in part largely to do with, where you're situated, the country you're in, your opinion of Russia. And so some of those geopolitical concerns come into your opinion of the vaccine and whether you think it's safe as well, just to make it more complicated.
No, I think, we can't, of course, forget about geopolitics and how, of course, that influences this as well. And I think Holly made the very interesting point, which something I hadn't really thought of, is how we know all of these factors that influence vaccine hesitancy around the COVID vaccine, but then how the reaction to the COVID vaccine will then have a forward-looking effect on vaccination and public health perceptions and things like that moving forward. And again, we're all just sort of speculating at this point, but I think that that's a really interesting, potential effect that we may see in the future. And again, I'm not a public health person, so I don't think, but I think that is a really, really important point. Sylke, I want to come back to you. And ask you an education-specific question. We've been talking about comparisons across EU member states in various aspects, and I wonder if you could talk a bit about these inequalities in education, both obviously before COVID and then, of course, the effects on learning outcomes because of COVID, and how these may affect differences between and among states, you know, in the short term and the long term, if we're going to see more, you know, sort of replicating existing divisions, if we're going to be seeing new divisions, sort of what that landscape may look like.
Yes. Okay, just to follow briefly up on the vaccines, because I thought this was really very, very interesting. And a little bit, I think, also when Martin stresses the point of social media and things, this makes us as scientists think about what do we learn about science, you know, about you know, science and what the role of science, right? It's something that I think for us is always then in mind, right? Okay, I just wanted to come back to your question. So yes, so I think what is very interesting, so to think about when you think about, you know, pre-COVID educational inequalities and after, and we do not have the data. So how can we possibly say something about Europe? In which direction is Europe going? How could European countries differ, given that we do not have comparable data? As I said, one possibility is to use these pre-COVID data and then to, in some way, think more about possible trajectories that we could draw out of that. And certainly the first thought is about how did countries differ in terms of length of school closure, right? And we have, for example, Sweden, which did not close for one single week with the schools for all kids. So we do not necessarily need to worry a lot about lack of learning progress in these countries, and it's the same as in Finland and Norway and France, Denmark. So these were countries where actually we had only we had less than 10 weeks of school closures. Okay, but then there are other countries like Poland and Ireland and Romania where schools were closed, you know, more than 20 weeks. And hence this already has a huge impact on the possibilities of kids to interact with a teacher. So the school closure policies differed a lot. As I already said, there's a big lack of resources. Poorer countries having more difficulties on their kids having the resources at home that they need. But in terms of overall of educational inequalities, what we also saw before COVID is that educational inequalities in Europe are very big. For example, if you think about Denmark, their kids who come from an academic family, they are about 1 year ahead in the average school outcomes to those from a non-academic family. Sorry, now I'm living beside a church, so now the bells go off. And on the other hand, we have Bulgaria and Hungary, France, where this disadvantage is twice as high. So kids from non-academic families lag 2 years behind. So this is before COVID. Hence what we looked a little bit at was not only the association of parental background with learning outcomes, but also the association of having already home resources. So these kinds of how important their home resources before, which in some way also are interlinked with socioeconomic background for sure. And then we saw how and then we looked at those countries which had in some way both, which lacked first where kids lacked a lot of resources compared to other European countries. And there also these resources were very important for explaining educational outcomes. And this shows that there are some countries where the situation is a little bit, which probably might have not only average achievement decreasing, but also lots of kids falling considerably behind. These might well be countries like Romania and Bulgaria, but also in some way Germany didn't fare very well. Even so, the administrative data results for Germany probably might be a little bit on the better side. But putting all these different kind of factors together, makes it possible to at least say something about countries' relative position. We do not need to worry about Northern European countries, that is for sure, which doesn't mean that they also have a learning lag, because administrative data shows that there's a huge learning lag as well in these countries. But even though they are better off, then you can imagine that those countries where we think things are pretty bad, these are the countries where policymakers, I think, should really focus on. So, I mean, long-term and short-term effects. As I said, I think what would be really important. So if you are an economist, okay, if you're an economist, and there's a lot of discussion of data, these educational achievement data being used for saying, look, if you have something like 10 point, or if a country has lower education achievement, then the GDP will be lower. So an economist who goes into this line would now say, look, what we will find is that economic growth will be affected in the long term. So this is if you go in this line, there's some rationale not to necessarily follow this kind of rationalization, because, for example, Estonia turned up to be in some way quite a wonder child in terms of educational outcomes, and still we do not see this so much related to GDP. So, however, I think this is something to consider. So there will certainly, you might, but if you look at the country level, this might lead, these educational inequalities might lead to different social cohesion in the future. But on the other hand, what we realized is lots of countries invested into digital infrastructure. And this was also differed a lot before COVID. And I think this huge investment might have even led to some cohesion. We do not know yet, but it's not very good always to stress the negative things. I think there has been some very fast development in digital learning, digital infrastructure, and so on. There's many countries focusing on that, and there might be some cohesion, which then might help to European countries to learn each other much better from each other, to use similar tools, and if we start really to focus on collecting data, to evaluate different tools much more easier, because we have the necessary infrastructure.
Thank you. No, that's a very helpful kind of tour of the issues at stake. And obviously, as we've touched on before, we can think of, sort of differences and as we've just been discussing across countries, but then of course, the heterogeneity within countries when we think about not only groups, which is what we started with, but across regions, across states, and the differences, of course, that how policies were implemented, whether they were focused on education or other things, and how that disproportionately affected different areas in various countries, which we know, and that obviously has long-term economic effects as well of those regions vis-a-vis others in their own countries. We have a couple of questions so far. I want to head over to those for a minute. And for those in the audience, if you have other questions, feel free, please, to put them in the Q&A, and I will ask them of our panelists. So the first question, and I think perhaps a bit speculation, but based on kind of what's been happening or what we know from experience in the past the past 20 months or so. And so whoever would like to take this, please just signal your finger, which is, how will European countries use or not use lockdowns to address the autumn and the winter's COVID spike that we are starting to see more of across Europe? Holly, would you like to offer your thoughts on that?
I wish I had a very clear answer to this question, because there are a lot of my colleagues who would like to know. So I think for some countries, they're considering it, or at least their medical communities have been saying, please do this. I think in some instances it's being considered, in other instances it's difficult. So, take Germany, for example, where they just had an election, there's negotiations happening. It's difficult for a leader to stand up and say, let's do this, because they're in the process of government formation. So that's caused some delays there. I would say the the tricky thing is that in the early stages of the pandemic, regardless of what governments did, people locked themselves down. If you look at Google mobility data, which is admittedly flawed somewhat, but at least a useful indicator of whether people were moving about or doing things or whether they were staying at home. In the early stages of the pandemic, people did tend to stay at home, even in places where the lockdown was not as strong. But so there was a fairly strong policy response. People also locked themselves down. Now you're seeing probably a less strong policy response and more fatigue from people in the population. And so fatigue isn't just about, oh, I'm fed up with this pandemic, although that's a part of it. We also have to consider people's economic needs and can they afford to stay at home? Can they afford another lockdown? And so how they feel about that might have changed quite a bit. Because as Martin said in the opening remarks, these lockdown measures were intended to be a short-term thing potentially, and we've seen like several lockdowns. And even in the first one, we were warning governments, and many governments were saying, well, we'll do this lockdown and then we'll be fine after that. We'll just lock down hard now and then we'll be better. And we were saying, well, hang on a minute, your messaging is wrong. You've set these criteria. You're going to have to go in both directions, and there might be multiple times when these measures need to be in place. And governments don't want to send that message out to the public in general, because they want to be seen as acting decisively to solve the problem. So there's a lot of concern over whether, I think in a lot of cases, these lockdown measures are certainly needed, unfortunately. It's to do with the capacity of governments and their willingness to do this, as well as their willingness and capacity to combine this with the social measures that would need to be in place to stop significant harm from the lockdowns. So all those things concern me. I don't have any definitive answers, but hopefully that was helpful.
So thank you, Martin.
There's two questions. One is whether there really is a spike. And following on from what Holly says, it's also a question of whether the governments recognise that there is a spike and that they need to do something about it. And one reaction at the moment is, well, let's hope it's not going to get much worse, that this is going to level off. I think the Netherlands has introduced a renewed lockdown, and I think Austria either has or is talking about doing it, at least in some parts of the country, so that there is a response that, well, we've got to take measures now, and then we'll see if we, how long they last.
Great, thank you. All right, we have another question, which asks if we can speak about worker burnout, especially in the healthcare sector, and its effect on the labor market overall. What expectations will future workers or laborers have when they engage with work in the post-COVID economy? Martin, do you want to take a stab at that?
I don't know, because a lot of people are complaining that they're burnt out, they've had to work too much. I don't know how they'll feel if things do, as I suspect, if things are substantially better in 5 or 6 months' time. I don't know how people will react. That's a psychology question I can't answer.
Yes, that's very true. Anyone else want to jump in on that, or can move to?
So sure. I would say that something that is true of both Europe and elsewhere is that burnout, I think, is affecting the younger people in the medical profession and public health professions a bit more than those who are a bit more seasoned. And so some of the research, this has really impacted a whole generation of relatively new medical professionals and public health professionals. And I worry a bit about what the long-term effects of that are on retention and recruitment of good people over time, both in Europe and elsewhere.
Thank you. All right, now for something different, which is the following. The audience member asks if you can speak to nationalist movements in various parts of Europe and how the pandemic impacts those movements. So nationalist movements, nationalist parties, And then they go on to say, for example, there have been observations equating some of the have-not elements that the pandemic has highlighted in the US as examples of eugenic tendencies. Have there been similar discussions in Europe? Anyone would like to take on that, or just more generally sort of the relationship between sort of nationalism, whether that's sort of nationalist movements, nationalist parties, response to vaccine take-up, response to lockdowns, mandates, mask mandates, things like that. You can think about protests, things like that as well. Holly, you want to address that?
Yeah, so there are certainly some, in political science, we talk about far-right parties. There are certainly some far-right parties and affiliated groups that have taken an anti-vaccine and anti-masking stance in different countries. And so that's a form of right-wing populism in that sense. What's very concerning is the extent to which people who are participating in protests and things like that against masking or other restrictions are invoking ideas around anti-Semitism, control of freedoms that relate to European history. I think disingenuously so, but it's quite disturbing to see that. And so parties are tapping into some populist sentiment or popular sentiment around opposition to some of these measures, which is pretty worrying in that sense, like the arguments that they're making. And the other thing around this is the kind of international similarity across countries about some of these claims and some of the actions that protesters are taking. You see protesters in Germany wearing yellow stars. You see protesters in America wearing yellow stars. They're doing some of the same things and using some of the same arguments. I also find that worrying, just in terms of the health of our democracies overall.
I think that's a very important point, that not only exactly are we seeing similar tactics and similar approaches across countries, but I think that I agree that what that means for, you know, sort of democratic deliberation and democratic conversation as well. Yeah, Martin.
Yeah, on a sort of milder note, I think there is a tendency for governments not to want to hear advice from outside. So if the World Health Organization tells you you should do something, well, why should we listen to them? We can surely manage okay here. And you don't need to be a particularly sort of strong nationalist politician to talk in those sort of terms. We've had that in the United Kingdom, where very early on there was a question, why are you not following World Health Organization advice? And the reply came back from a leading figure in public health: that's the World Health Organization. We've got an excellent health service here. We can manage without them, which of course was completely false. And similarly in the Czech Republic, there was a time they got a warning from the World Health Organization: you're running into trouble. This was more than a year ago. You're seeing your positive test rates going above 5%. We take that as a danger signal. You're allowing this to go out of control. And they say, well, we think it would be better if they just kept quiet and let us handle it. We know perfectly well what we're doing. And I think just that sort of, I'm not interested in listening to anybody else, goes with nothing approaching the most extreme forms of nationalism, but has been a very negative tendency.
Thank you. So I think we have one final question, which is the following. In the US, there's been a focus on being sort of positive, moving forward, and finally being able to spend upcoming holidays with family or go on vacation. But here, the debate, that discussion is often impacted by the regions and social groups who refuse both vaccination and masking. And the audience member asks if similar sorts of considerations are happening in Europe in terms of making those decisions of travel, to visit family, to go on holiday, based on what's happening in the local environment regarding vaccine rates, mask mandates, masking more generally, that kind of thing. Yeah.
Yeah, I want to respond specifically talking about the UK and even more specifically probably England. And so there are other perspectives from other countries, but in England, the conversation for this year and last, there was a lot of discussion of how can we save Christmas? How can Christmas be a family event or social event? And so that's quite similar, I think, to some of the arguments that get made in the US. That said, I don't think it's necessarily a very useful set of arguments. I would like to see good public health policies put in place, please, England. My sense at the moment is that the English government would particularly like the pandemic to go away, and to especially, they want to present this as the pandemic is daily life now, we have to live with it, and as long as we're vaccinated, it's not a problem. But the issue is that this is, vaccination is not everything. There are some breakthrough infections. More than that, each country is in a global system where until every country is largely protected, either through immunity or vaccine acquired or otherwise, then the disease is going to continue to spread, and we might get new variants and some more bad surprises might happen. So I think some kind of normal life is, everybody has to come to terms with how to have the best life that they can with some of these restrictions. But we do need to think collectively about what is not just best for us in terms of each country, or even me as an individual or my family. We have to think collectively about what's best for society. And I see some of that lacking in the conversation around, well, let's all get together and celebrate. The pandemic's not done. And so there are still measures that we might have to take for quite a long time into the future.
Well, thank you. I think that's a good point to segue to maybe a final question. We're at about 10 minutes left, and I know we can, of course, continue all the aspects of this conversation, but I want to give all three of you a chance to offer some final thoughts, perhaps on things that we may not have touched on, or things you wanted to get in that didn't have a chance to. And I guess perhaps in a final, kind of round of everyone, perhaps you could also think about, and this has come up at various points as well, but in our conversation, but to more maybe explicitly think about sort of timelines for recovery. I realize, again, we're still in the pandemic, but we are thinking about, already obviously recovery and what that looks like in the ongoing pandemic, and different sectors and things in areas that you think most about. So perhaps, Sylke, if you want to start us off with some final thoughts, perhaps addressing this in the education from the education perspective.
Okay, so then I might start right away with what I said at the beginning, the problem of data and Hollywood. So quite a point, I think, for education, and I think for the development of education policies in order to counteract all any lack of learning progress that has appeared, it's just very important to have data, and it's very important to have data to monitor educational outcomes and to monitor what is working in order to see, because it's in the education area, it's not quite sure now how we know that there's a lack, because administrative data shows, for example, for the Netherlands, that 8 weeks of school closure decreased led to a learning loss of 20% of the school year. So this administrative data, which is registered data, so it covers all kind of pupils, is actually quite alarming in terms of the actual extent for single countries on the learning loss we are facing in Europe. And these are countries, as I said, that actually seem to be relatively even doing quite well in terms of the school closure duration and the learning resources at home and so on. So I mean, it is a concerning. It is really concerning, and I think I think we Europeans really need to think, and we are thinking about how to counteract that, but without really having good data, and thinking more about getting timely data, like data on health, like data on employment and so on. I mean, we need to make education to be measurable more timely, like other sessions, because like other research areas, other areas. Because otherwise we won't be able to give good messages to policymakers. And as long as we can't give that, then we can first not show how serious the problem is, and second, we can't give advice what works. Because we just that's really important. However, I think in terms of the education area, it's really important to, from what we know, to really, in terms of implications, you know, to support very low achieving students, and to, if we don't monitor at a regional level or country level, at least let's monitor within the school and find out who are the worst achieving and support them. And to exploit now the newly created or digital infrastructure and create and work further on that, which is something which is on a high political agenda also in the European Commission at the moment, to foster that. In terms of the timeline, you know, if there's a data lack, then it's very difficult to also say. If you don't know the actual extent of the problem, it's very difficult to say at what point will we overcome it, right? So there are studies. There's a study which is interesting, saying that, look, if we now give 1 hour extra tuition, because extra tuition is something that has been shown to probably be quite successful in helping kids to overcome the learning lack. If you give 1 hour of extra tuitions from our 5th graders until the end of the high school, then that will help overcome the learning lack. So, but I think I wouldn't like to engage here further on what we overcome on this, due to obvious reasons. And then there's something, I mean, in general, if the final work is to give more credit to the teacher profession. I mean, we discussed the difficulties they are facing, we discussed the difficulties to that which they have to adapt. And I think research shows for the first waves, these big, so the first lockdown, these big impacts, but there's some, you know, case evidence showing that things got much smoother later on. And I think this is due to the school's efforts and teachers' efforts to, and adaptation, flexibility to help children in this difficult time. Thank you.
Thank you. Martin, final thoughts.
Well, final thoughts. I think it was one of the questions you put in is, what's the timescale for recovery? When are we going to come out of this? And so to suggest that it is unknown, we don't know, we can't know, but there's got to be a reasonable chance when we reach 90% of the population vaccinated. And if we're revaccinated every 6 months, there's a reasonable chance that a fair amount of normality returns. It won't be an exact return to the past. We actually have gained something. I think these sort of Zoom meetings are a benefit. If you had invited me to come to Pittsburgh for this, I think I would have felt that that just wasn't serious. But this is certainly something we've got used to. I think there's a greater acceptance that for a lot of kinds of jobs, people can work from home. They probably work better from home. And if that's what they want to do, then that should be supported and encouraged. And the view that you've got to whip people back into the workplace and supervise everything they do, hopefully that has taken a bit of a blow. So there may be some positive things will come out of this as well.
Great, thank you. Holly, final thoughts, and perhaps one question I didn't get the chance to ask you, which I really, so maybe you can wrap this in, is to briefly talk about Brexit. I feel like Brexit, I know briefly is like impossible to talk about Brexit, but I feel like Brexit is always like everything we do now, we have to kind of, and then Brexit's effect on this. And when you were talking about sort of specifics about England, I was thinking, oh, there's going to be a mention of that. So maybe just thinking about sort of timelines and a brief thought on that also. So
I wanted to try and say something that was in the lines of the positive things that everybody else had said.
Okay, we can bookmark
that. No. But so Brexit is a complication for the UK because it's added an additional layer of disruption. I'm engaged in a project right now with the Nuffield Trust in the UK where we're mapping the health consequences of Brexit. And of course, it's hard to separate the health consequences of Brexit from the health and economic consequences of COVID. I would say that Brexit has acted as a catalyst in some of the same ways that the pandemic has acted as a catalyst. We're at a moment where I think in general, there needs to be some reflection and some reckoning around the way that we've structured the economy and the society, not just in the UK, but elsewhere in Europe. I would like to see good reflection on that and maybe some progress, but I'm not sure I'm going to get that. But that's my positive thing, is maybe that there would be some learning coming out of this, as well as some of the sort of restructuring of education and work around some of the things that my colleagues on the panel have just mentioned. Brexit has made things a little bit harder on the UK because it's placing a bit more strain on supply chains, a bit more strain on the labour force in certain sectors. And that is certainly the case for health and social care workers in the UK. And I would like to see reevaluation of the role of public health in Europe, and a reinvestment in some of the public health functions of government, partly because it's cheaper, and public health is cheaper and more effective than medical care. But I think there's also got to be a conversation around inequality more broadly. Who gets what, who is paid what, and how we distribute things in a lot of European societies. Some countries where people, I think, had the common idea that there was greater equality, the pandemic has exposed places where that's not the case. So we need to learn from that going forward.
Great, thank you. I think that's a great point to end on, and I think obviously those timelines will vary across countries. Well, we are just about out of time. I want to thank all three of you for a wonderful conversation. We touched on all sorts of topics, and I know our audience was very appreciative and very engaged in everything that was discussed. Thank you to all of our partners as well, and to everyone that joined us in the audience. For those in the audience, there's a link in the chat for a brief survey that we would ask you to complete, just to give you some feedback, to give us some feedback on the event. So please take a moment to do that. And otherwise, I hope everyone in the US has a good afternoon, and in Europe has a good evening. Thanks very much.